How do you fix a catch in your shoulder? Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain what causes a catch in your shoulder, as well as what you can do to fix a catch in your shoulder. So first of all, what is it that causes a catch in your shoulder? Well, when you're reaching, you're raising your arm up this way, and your shoulder is basically a ball and socket joint. So as you raise your arm up forward, that ball rolls inside that socket. And as it's rolling forward, it can start to glide up in the socket and glide forward in the socket. And that can pinch your rotator cuff tendons and give you that catch when you're going to reach upwards. Now that ball that I mentioned, it's not a perfectly round ball. So once you get past shoulder level and you get up here, a lot of times people can go the rest of the way without too much trouble, but they get a catch, or it's sometimes called a painful arc, when they're in that 60 to 120 degree angle. That's where there's a bump on the ball that kind of jams up against the arch that runs over the shoulder, and it can pinch your rotator cuff tendons. So what do you do if you're getting a catch in your shoulder? How do you fix that problem? Well, there are a couple tips that can help if you're getting that painful arc or that catch as you're in the mid-range of reaching or going up over your head. The easiest and the most helpful tip that I've found for most people who have this type of problem is just paying attention to your hand position. That when you're reaching thumb down or thumb out like this, it rotates your shoulder in a position this way. That's called internal rotation, where your arm rotates towards the midline of your body. And there's a little bump on the outside of your shoulder that as you go into that internal rotation position, it rotates that bump underneath the arch on your shoulder. And as you raise up, you're more likely to pinch the rotator cuff tendons that attach to that bump, which is called the greater tuberosity. Now, if you can turn your thumb up or turn out slightly so that you're reaching more with a thumb up position like that, it brings that greater tuberosity out to the side and out from underneath the arch of the shoulder so that you're not pinching or catching tendons as you raise your arm up. So instead of reaching forward like that, think about reaching with your thumb up. Now let's say you do have to pick something up like that. Your forearm can move independently of your shoulder, but it is natural that where your thumb goes, your shoulder is going to follow. You can see my elbow kind of comes along with it, and that elbow motion is really what determines where your shoulder goes. So if you think about reaching up for something, then once you've already gotten there, just turn your palm down. Notice the elbow is staying fairly still like that. It's just a forearm rotation. So reaching up, thumb up, then turn palm down to grab whatever you need to do. Can help you to keep your shoulder in the right position as you're reaching so you don't get that catch in the shoulder. Now the second piece has to do with the actual arch of the shoulder itself. The arch over top of your shoulder is part of your shoulder blade. And as you raise your arm up, normally that shoulder blade should move up and kind of out to the side. The lower tip of your shoulder blade should get out to about the line running down vertically from your armpit there. And if that's not happening, if that shoulder blade's not rotating upwards as you're raising your arm up, then you're more likely to pinch against the arch of the shoulder because the arch isn't moving upwards. And so when you are raising your arm up or you're going to reach for something, you don't want to just make it an arm movement like that. You want your whole shoulder blade to come along with it. So if you're reaching forwards, it's kind of like throwing a punch like that. You're not just going to jab with your arm. You want the whole arm and shoulder blade to move together. Your body actually kind of can get into the motion a little bit as well, causing a rotation if you're reaching forwards. Or if you're reaching upwards, you want the shoulder blade to kind of come along with the arm. So it's not just arm movement right there where you get that pinch in the top of the shoulder blade. You want the whole shoulder blade to come up and around. So it's a long arc motion where everything's kind of moving together, the shoulder blade and the arm. They describe it as a 2-to-1 ratio where your arm moves about twice as much as your shoulder blade, but they should move together as you're raising your arm up. So those are two tips to help if you do get a catch in your shoulder. Now, beyond that, having some physical therapy, particularly with a manual physical therapist like we are at More for Life, to help get the ball centered in the socket and to relieve some tension on some of the muscles that may be pushing the ball either forward in the socket or allowing it to ride too far up in the socket so that it makes you more likely to get that catch. Relieving the tension on some of those muscles can be helpful to help you avoid getting catches in your shoulder. And if you are having some shoulder pain, if you're getting catches or trouble reaching above your head, then we'd encourage you to reach out to us here at More for Life if you live in the St. Louis area, and we'll be happy to help you out. Now, if you're watching this video from somewhere else, but you found it helpful and it helps you to avoid getting a catch in your shoulder as you're reaching, then give the video a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching and have a great day.